What is the difference between pulmonary TB and common respiratory infections? Imagine trying to tell apart two illnesses that both affect your lungs but are very different in cause, course, and treatment. That's what we're exploring today. Pulmonary tuberculosis is a bacterial infection caused specifically by Mycobacterium tuberculosis. It's contagious and can stay hidden in your body for years before showing symptoms. It usually develops slowly, with signs like a cough lasting more than 3 weeks, coughing up blood or thick phlegm, chest pain, night sweats, fever, and weight loss. Because it can be dormant for a long time, diagnosis involves special tests like the tuberculin skin test, blood tests called interferon gamma releases assays, chest x-rays, and sputum samples to find the bacteria. Treating tuberculosis takes a combination of antibiotics over 6 to 9 months to fully clear the infection and prevent the bacteria from becoming resistant. Now compare that to common respiratory infections like pneumonia, bronchitis, or the common cold. These are caused by different germs, bacteria, viruses, or fungi, and tend to come on quickly. Symptoms usually appear suddenly and include a fever, a cough that may be dry or produce mucus, shortness of breath, and chest discomfort. These infections often resolve within days or a couple of weeks with appropriate treatment, which could be antibiotics for bacterial infections, antivirals for viruses, or just supportive care like rest and fluids. Diagnosis is generally based on how you feel, supported by chest x-rays and cultures, but it doesn't require the long, complex treatment regimens that tuberculosis does. The main differences start with what causes them. Pulmonary tuberculosis is caused only by Mycobacterium tuberculosis, while common respiratory infections can be caused by many different germs. Both can spread through airborne droplets when someone coughs or sneezes, but tuberculosis bacteria can stay suspended in the air for hours, making it easier to spread in crowded or poorly ventilated places. Tuberculosis has a long incubation period, sometimes taking weeks or months to develop symptoms, and it tends to be a chronic illness. In contrast, common respiratory infections develop rapidly and usually clear up quickly. Symptoms also differ. Tuberculosis often causes a persistent cough, weight loss, night sweats, and sometimes coughing up blood. It can cause lasting damage to the lungs, visible on imaging as lesions or scarring. Common respiratory infections tend to cause sudden fever, cough, and breathing difficulty, but they usually don't cause long-term damage if treated properly. Diagnosis for tuberculosis involves specific tests for the bacteria, while for common infections, doctors relying on clinical signs, cultures, and imaging without the need for prolonged treatment. Treatment for tuberculosis is lengthy and involves multiple antibiotics over many months to ensure all bacteria are eradicated. In contrast, most common respiratory infections are treated over days or a few weeks, often with simpler medication. Because of its chronic nature and potential for spreading and developing resistance, tuberculosis is a major public health concern worldwide. Common respiratory infections, while widespread, are generally less severe and resolve more quickly. Understanding these differences helps in recognizing how serious tuberculosis is compared to everyday respiratory illnesses. It also emphasizes why accurate diagnosis and appropriate treatment are so important. If you suspect you have either, consulting a healthcare professional is essential for proper testing and care. Remember, each person's experience can vary, so personalized medical advice is always the best route.